Hey everyone, happy Monday. Question we get all the time in our office: do I just have tight hamstrings, or is there maybe something more involved? Hello, my name's Dr. Brandon Bupp, and I want to educate you guys, give you some information on what you can use to determine whether it's like a hamstring tightness, or if there's more that you should be looking into. So the first thing is, when does it bother you? So in this particular case, the person came in and they said, I have more pain when I'm sitting, and if I'm sitting throughout the day, then I get more discomfort. The truth is, that's always a lower back issue that's creating tension on the hamstrings. Now, could you have a sports injury, or could you be running and have overuse injuries or overuse strain with the hamstrings? Absolutely. Guys, I think it's probably 90% of the time when we see people that go, I got pain like this and it's worse when I'm sitting, it's really a lower back issue. And hamstring problems are, regardless of whether it's a person who's a runner, person who pulled their hamstring, I want you guys to understand something. The hamstring is attached at the back of the knee, the lower leg, and in the pelvis. So the part of the pelvis that the hamstring attaches to is right here, the ischial tuberosity, and then it runs the back of the leg. So if I have bad position in my pelvis, which is a really common and a significantly overlooked issue with people in their lower back. So I got bad alignment in my pelvis, or the SI, this is the ilium, this is the sacrum, doesn't move like it's supposed to. So when I walk, it should move forward and backward. That takes stress off my hip, but it also takes strain off my hamstring. So if this thing is tilted in a bad position, the position of my ischial tuberosity changes, which means it increases tension and stress on the hamstring itself. So that's if the hamstring is actually the problem. More commonly than all of that is there's actually a problem with the disc in the very lower spine. So typically it's L4, L5. Here's another education piece. The sciatic nerve is made up of 2 to 3 other areas of the spine. So it's not just one. It's actually several, 3, 4, it's actually several areas that are coming together. L5, sacrum, several areas that are coming together that form the sciatic nerve that runs down the back of the leg. So when somebody says, I have sciatica, or maybe is it possibly sciatica? Do I have a tight hamstring? Sciatica is always pressure or stretching of the nerve because of bad position or bad biomechanics in the lower back. Puts stress on the nerves that run down the leg, and especially if it's happening in both hamstrings. So hopefully that can kind of clear some things up. Guys, here's the significance. If it's a nerve problem, those nerves control your bowel and bladder function, control your reproductive organs, guys, prostate. It also controls the strength of your legs. And listen, it controls your balance. It controls and coordinates the proprioception, or the coordination, the understanding of body positioning, so you know where you're at when you're walking on the ground. Guys, when your feet are contacting the ground, that you know with the position of your feet, that information is getting to the brain. So bad positioning, stress on the spine in the lower back is a significant health issue. How do you know? This isn't a Google question, guys. This is an examination and an evaluation question with a professional who's an expert in this. Guys, we see hundreds of people every week where we're evaluating, is it a hamstring problem? Is it a spine problem? Is it a nerve problem? Which is why we are very, very good at it, because it's something that we do repetitiously. So I would suggest that you find somebody that can evaluate this thing and really give you the information to tell you which problem it is. And then you can use those stretches that we talked about. If it's a nerve problem, sometimes we don't want to stretch it at all. We just want to let it calm down. So get evaluated. If you know of somebody with back pain or leg pain, guys, please share this video with them. Our office would be happy to answer any questions. We always offer a free consultation. And we do that just so that we can tell somebody whether or not we can help them without them having to invest a lot of money into the doctor's appointment. So hope that helps. If you have questions, comment. Please share this with people. And hope you guys have a great week.